So, CoolSculpting is cryolipolysis, whereby the fat is frozen, and then after the fat is frozen, the body reabsorbs it. So imagine a stick of butter where the CoolSculpting device is applied, and then that stick of butter is frozen, and then eventually it will melt, and then eventually your body will take care of it, like a bruise or a hematoma. You know, you hit yourself and you see a big old bump, you see a big old knot. And then eventually the body will resorb all the inflammation, all the red cells, and all the swelling will eventually go away. Same type of scenario happens. Patients ask me all the time, what happens with the fat? Well, first we freeze it and then it just dies off and we pee it out. I do still love CoolSculpting. It was the original non-surgical fat reduction modality. I started with CoolSculpting in 2007. I bought the device. I was one of the first doctors to start using CoolSculpting in South Florida. And I've had the same exact machine actually since then. And I've been using it all along. I enjoy the effects and the benefits of CoolSculpting. I think it's one of the most neat and interesting developments in all of aesthetic medicine. But I think there's been an evolution in the whole field, and I think some of the newer devices serve a different purpose and a different role, and actually are just as good in a different type of patient, and they can actually augment the entire experience. You can even vanquish one patient and debulk them and reduce their circumferential fat in certain stubborn areas. And some patients that do not go away with the vanquish can be sculpted. And then the icing on the cake could be M-Sculpt. M-Sculpt can be used as a standalone procedure. Right. And some patients who are already kind of dieting and exercising and just want to get more bulky.
You need a little push.
You need a little push. And then, the beauty of these things and the beauty of the fact that they're non-surgical and they're very little downtime to no downtime. You have to take time off work.
Right. Everybody always asks that. What can I do stuff like after this appointment?
That's the beauty of them. Yeah. There's no surgery. There's no scars. There's no anesthesia. There's no going to the operating room. There's none of that fear. None of the fear of the knife. There's no recovery. There's no bandages. There's no, what do they call those girdles that you have to wear? The pupa, or there's none of that. I forget the name. You don't have to wear those. Yeah. And so that's another great thing. And also, nobody has to know.
You know, you could, if you don't want anybody to know, if you're one of those.
Yeah, I mean, that's another thing. You don't have to take 2-3 weeks out of your life to kind of hide out and conceal the swelling. But the most amazing thing about them is they work. Yeah. So you would think that, or it's normal for anyone to be skeptical about things that are just sold as, oh, you don't have to do this, you don't have to do that. It's great.
We were, if you think back to, even when you first got CoolSculpting.
I was skeptical of all these, and it's a good thing to have a skeptical doctor because you want to really pick apart the procedure that you're going to recommend to somebody. You want to make sure that when you recommend it, that you know what you're recommending, and you know that it's going to work.
You want to know the science is there.
Exactly,
you want to see that there's
all of these devices I've tried on myself. I've tried on other patients, and I could recommend them knowing that they work. Now, the most important thing to do is to know who they work for when you recommend them. So a blanket statement that says CoolSculpting works for everybody, or Vanquish ME works for everybody, or M-Sculpt works for everybody, you should be skeptical of and weary of. But in the right patient, in the right setting, and the right device, I would say that they all work. Yes.
Yes.
We treat the patient as a whole and look at them holistically. We definitely don't recommend non-surgical fat reduction to patients who just need more of a nutritional diet and exercise approach first.
Because that's going to carry them through a lifetime.
And it's going to produce a healthier, happier person. You know, if somebody is just not dieting or exercising appropriately, then that's the first step. I think before we start any of this, we want to make sure that the patient is well educated and knows what they're getting into, and also has a result for life, so to say. And I think patient selection is crucial, very important. We want happy patients. I've been doing this for 15 years. I intend on doing it for 15 more, and I've been in the community for that amount of time. And what I tell to patients is what I would tell if I'm a member, and I pride myself in that. And so I wouldn't recommend something that I didn't think would work. Sometimes you do your best and you recommend something and it just doesn't work, and everyone is so different. But the goal should always be to educate, enlighten, and also encourage the patient to follow certain safe and healthy guidelines in order to maintain and keep their results through life. And then it's always a good start too, before any kind of procedure, whether it's surgical or non-surgical, to have that discussion. Where are you in your diet and exercise routine? Are you dieting and exercising? Are you using this to lose weight, or are you using this to supplement weight loss? Are you at a plateau? So those are all important questions to ask patients who are trying to undergo non-surgical fat reduction.